call Chrisitan Ragland, who is our health chair, and also the vice president. And I say this every meeting, it's becoming more important now. We have to support this young man, not just because he's a member, but he's doing something that's under fire from Trump and his foolishness with disparities in health and having people have equity and justice. He's the vice president for equity, inclusion, and diversity in AtlantiCare.
Awesome. Well, first I want to piggyback on Mr. Sar. First, thank you again. And I ran into Mr. Sar in the elevator at one of those meetings that I wasn't allowed into. I was sneaking. I was listening, putting my ear to the door. But I'm grateful for you and your role. And I think to go back to what can men do, I want to think about this as someone who has 3 small children, 5, 7, and 8. The person who was my biggest supporter was my father. He was at every last one of my wife's delivery. He was there with me. He was my support. So I think to your point, there's a role for men. I think we got to go back to even looking at the family dynamic of where everyone's role is as it pertains to life and life expectancy. So there are a lot of things that we're working on from the health equity standpoint to support the great work that Mr. Sari is doing. And as we were talking about earlier, that medical arts pavilion that's on Ohio Avenue was built specifically with CRETA dollars to help tackle health disparities, particularly maternal and infant mortality. So I think we're going to continue to push that forward. But I just want to highlight a couple things. So President Shabazz mentioned some health interventions, and he mentioned life expectancy. And so as you all know, I've been working directly with our chapter along with my role at the hospital to increase life expectancy. And the number, I should say, the second to worst mortality reason in Atlantic City is cancer.
Yeah.
All right, so I want to start with some good news. Last week we had a really creative pilot with O&A's Barbershop on Atlantic Avenue. I brought LabCorp down and we screened 20 African American men for prostate cancer. And I'm happy to report 95% of them are good. But there was a person who had elevated levels, which one of our doctors said we probably saved his life because he had not been even thought of to get a prostate exam. And how we were able to get those individuals screened, we gave them free haircuts. And so that was a caveat. So that was a trial, we did really well with that, and O&A's was really grateful. But the reason why I'm here today is March is, let me look at what the food you guys ate first.
Baked fish.
Baked fish. The reason why they're doing this is the first time they had fried chicken, and I was talking about hypertension and diabetes.
No more fried food.
No more fried food. The reason why, March is colorectal cancer month.
Right.
And that is one of the leading causes of death for black people, particularly black men, especially younger. It used to be you wouldn't get screened to 50, 55. They're now saying you need to be screened at 45. And then the other caveat to that is, from a health equity standpoint and having access, a lot of people don't even know if their insurance will allow them to receive a colonoscopy. And so we got to fight that and we got to combat that. As a matter of fact, I was at a conference a couple of months ago and there was a big insurance broker there that you all would know. I'm not going to name for the sake of not putting my name in that on minutes. But they were saying, oh, we got to fix health equity. We got to fix these health disparities, all these things. And I politely raised my hand and said, we would love to do that, but your insurance companies are the one denying the screenings.
That's right.
Because of age. But we're telling you we're high risk. And so colorectal cancer month is one of the months that I'm very passionate about because of how impactful and how many deaths we have seen prematurely because people are not being screened for colorectal cancer. The other thing is, just so you all know, if you know somebody in your family, whether mother, father, sister, brother, we call that first degree relatives, if they have colorectal cancer, you need to be screened immediately. They usually say from 10 years from that person's diagnosis. If you have a cousin or someone like an aunt or uncle, we call that second degree relatives, you still want to be screened as well. So why am I here today? There is an opportunity we talked about in our work session today. On March 31st, we're going to partner with our health committee and AtlantiCare, and we are going to have health screening opportunities where we will send, there's a resource called Cologuard. Cologuard is an in-home kit you can use. It's not a colonoscopy, but it's close enough where you can send it back and they can tell you the results if you have any DNA or anything of that nature. If they find something, they're going to send you to get a colonoscopy. So we're going to do a health education event at Second Baptist Church. I think that's what we decided, right?
Second Baptist.
We wanted to find a neutral location, so we decided to go to Second Baptist. And we're hoping that many of you will spread the word to get people out, because we believe that this is a silent killer that people are not aware of.
And it's free.
And it's free. All right, and so if you come, if you're not insured, we have the representatives from Exact Sciences who built Cologuard. They're going to be there to give you a free box. If you do have insurance, our HealthPlex will be there as well to help you with that. What time? 6 p.m. to 8 p.m. 6 to 7:30.
6 to 7:30. Right?
Yeah, we don't want to spend 2 hours talking about colorectal cancer. It's not a comfortable topic for people, so I don't want to scare people away. The other thing that I want to mention is, this is my last piece. I chair the New Jersey Hospital Association Diversity, Equity, Inclusion Committee. So that's all of our hospitals in New Jersey. And one thing that I've been bringing up more frequently is age-friendly measures. Some of you may know this, but the Center for Medicaid and Medicare has a new measurement out there where they are looking to look at communities that have individuals who they consider to have social isolation, meaning people who don't have family at home, particularly our elderly population, and finding ways to make sure we engage them. I want to applaud Mayor Marty Small, because the Senior Services Department here do so much as to getting people out. That is going to be him. I think he deserves a lot of credit for that. So, but we want to also, we don't want to just talk about screenings. Let's make sure our neighbors feel engaged. Let's make sure our neighbors feel that they have resources, and that social de-isolation is also a killer as well. When you're lonely and no one's checking on you, and these things happen, that's when we start to find people really deteriorating with their health and just their overall engagement with life. So, as always, thank you all for listening to the update. So we'll send out an email with the Colorectal Cancer Month. We look forward to continuing to partner with Ms. Asari as well. And I firmly believe that the momentum that we carry today can really last for generations. So thank you all for that.
Thank you.